fear and anxiety with going to a doctor or a hospital probably resonates with most families and most individuals when they have children with them. It's a scary place, and most of it is scary because it's the unknown, right? Or an experience they had in the past was a negative experience. And so the fear from that negative experience just kind of increases as the child thinks about it more. So there are a number of different ways to help children with that fear and anxiety with the hospital. And probably one of the best ways is preparation, right? So we know the more that kids know, the better that they'll react. And so for a long time, it was believed that we just didn't tell them anything and we get there, we deal with it when we get there, but we know that's not the best way for children to cope. And so making sure that we're letting them know about what's going to happen, giving them the appropriate sensory information about maybe, especially now during COVID, what it's going to look like when we go into the hospital, but there are people wearing a mask, which we probably know now more than we've ever done before, but people will be wearing gowns and goggles and gloves and why they're wearing those. So just making sure that we're giving them the appropriate information that they need to know before we go in. And then making sure that if you are the caregiver, that you are speaking for your child and you're advocating for them and their needs. So if you're fortunate and you're in a children's hospital, you could ask the staff there, and I suggest asking in advance, like if there are professionals, like such as a child life specialist, that can help during those procedures, because there's all kinds of things that they can do. So they can also help with preparation and giving them a few more details that are appropriate for their development. They can work with doing distraction with developmentally appropriate toys and items that kids really engage with or really make them happy, and so that there's something positive happening. They can also help give them attainable roles and give you a role as a parent or a caregiver. So your role could be how to hold your child most comfortable for them and how to engage with them. And so there are multiple different things to do to make that experience a positive one. And that's definitely what we're trying to do, is we're trying to make those experiences positive so that that fear of the negative experience doesn't keep adding to itself.